Everyone, my name is Irina Desak and I want to present my scientific research work on the topic Enhanced Classification Models for Heart Disease Prediction in Precision Medicine. Besides, I want to thank Natalia Boyko for helping in preparing the research. So, as far as you know, heart disease is underlying cause of death around the world. More than 300 million people live with heart disease, and another 2 billion are at risk. So, with the development of technology, it's time to increase the statistics. So, let's speak about advantages of machine learning in medicine. First of all, machine learning expands the expertise of doctors by preserving the history of various diseases and their symptoms. Machine learning also reduces the number of medical errors and offers the provision of an expert level of medical assessments without personal involvement. And after all, machine learning accelerates the process of data collections and analysis. Let's briefly clarify the details of the work. So, the object of the study is medical indicators like ECG or another diagnostic results. The subject of research is classification models and the ensembles. The scientific value of work in modifying method to improve the accuracy and the practical value of the work is to develop a ready to use method of classification which will reduce the risk of misdiagnosis. Let's turn to data exploration. So, in most cases, the diagnosis of heart disease depends on a complex combination of clinical and pathological data, and the relationship can be hidden or not obvious. So, I decided to use a dataset which is collected from real patient data, and in total, the data set contains data on 303 real patients with 59 features. All attributes are divided into four categories like demographics, ECG results, various examinations, and laboratory characteristics. So you can see the video that shows an overview of the data set and a plot of the target feature, which shows that the dataset is unbalanced. This was taken into account when evaluating the model. Now let's talk about data preprocessing. So first of all, I processed attributes that have text values, then detected and replaced missing values. And the next step was detection and removal of duplicates and outliers using the score method. For feature selection, I used for method, each of which gives specific features as output. So PCA give us 20 features, decision tree 13 features, recursive feature elimination 30 features, and linear SVS 25 features. For finding out key dependencies, I built a correlation matrix and then explored different plots in combination with different features. You can see the process of discovering in a video, and I will try to emphasize the most relevant. So, it was found that women and men have slightly different rates of the heart disease, and in addition, men get sick more often. Besides, age is also a risk factor. Moreover, with age, high body mass index is more common in sick people. More addictions can be seen in my note, and there are confirmation from medical research in real clinics. Now I want to pay your attention to the methods I researched. So this basic classifications like logistic regression, naive Bayes classifier, decision tree, and SVM. with SGD. Besides, I use basic ensembles. These are bagging, boosting, and random forest. Let's move to the results. So this is logistic regression. It is plot of the results on the initial dataset, and on the left side you can see the legend of the scores with their colors. And I would like to pay your attention that in addition to the 4 basic scores, I also used the Kappa-Cohen coefficient. So now let's apply min-max color. You can see a bar plot of the results using different methods of feature selections. And let's apply the standard transformation. So you can see that the recall is lower compared to the previous transformation. And now let's turn to the next classifier. So it is naive Bayes. In the initial dataset, the results are worse than for logistic regression. Let's apply all filters at once. We see that the standard transformation shows better results compared with min-max color. Next is decision 3, visualization of the initial dataset and also using different methods of feature selections and transformations. And the last one is EGD. Let's apply filters at once. So we see a high score of recall, but at the same time a lower rate of Kappa-Cohen coefficient. And now let's discuss the results. So you can see that HGD is leading according to the main score, recall. However, Kappa-Cohen coefficient is low for HGD, like 55%. So naive Bayes and logistic regression are better in case of healthcare and for this task. Besides, as the problem decides the fate of the people, I performed modified models that can improve results. So let's look at the architecture of this model. So imagine that we have 2 basic models like XGD and XGBoost. Their results are aggregated by logistic regression stacking, and this is our first layer. The second layer uses naive Bayes and decision 3, and their results are aggregated by weighted bagging, and besides, weights are calculated based on the results of the first level. Let's look at the results based on this model. Look at the second table. So the results on all metrics are better than for basic classifiers or for the ensembles. And in addition, the recall score, which is the most important for the chosen task, has improved a lot. To sum up, I would like to say that potentially the study will help to understand better the main factors on heart disease, and the introduced model, which can be used in medical institutions, will increase the accuracy of diagnosis. And as a result, the number of saved lives will increase due to timely and correct diagnosis. So that's all from my side. Thank you for your attention. If you have any questions, please feel free to ask them.